A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Hima Pandya ma'am. So, ma'am is a reader and HOD in the Department of Physiology and Biochemistry, Government Homeopathy Medical College and Hospital. Today's ma'am topic will be importance of physiology in learning homeopathy. We welcome you, ma'am. We welcome you all the participants. Session is all yours, ma'am. Thank you.
Thank you very much, Dr. Lavanya and all the team members for inviting me for such event. I'll try my best to give maximum as I'm trying. Okay, so our today's topic is related with as I am the teacher of physiology and biochemistry subject. My interest is more of the physiology, and yes, there is integration of physiology with the homeopathy. As we are homeopath, how we can apply the knowledge of physiology in homeopathy. That is main thing that we are going to learn today. Okay. So myself, Dr. Hima Pandya. I'm a reader in HOD, Department of Physiology and Biochemistry, Government Homeopathic Medical College, Detli, Gujarat. As we proceed with the topic, let me have some introductory aspect of the physiology. So please, next slide. Okay. So here we will have certain points to discuss. First, we will have the discussion on what the physiology is, and then the integration of the physiology with the homeopathy, and how we can apply the knowledge of physiology in field of homeopathy. That we will learn. Okay, next, please. So, as a teacher, I must introduce the physiology. First, what the physiology is. Am I audible? Hello? Hello? Hello?
Hello. Yes, ma'am, you are audible.
Okay, thank you. Okay. So physiology is the study of functions. It is the functions of the living organism, which is with their mechanism and regulation of coordination. Physiology is a branch of medical science which deals mainly with the normal functions of the body of the living organism. It is not just a function of one or two parts. It is a function right from the cellular level, organ, different systems, and the body, which helps us to integrate which is helping in the integration and control of the different organs and systems for that for the smooth functioning of the body and the system. See, right from the cellular level to the different system level, how the functions are controlled, how the functions are maintained. That is been done in the physiology. And physiology is not just a study of function; it is a dynamic function. As which are the functions of the living organism normally occurring. For example, respiration, digestion, secretions of the hormones. All these are dynamic functions. We can just imagine how dynamically the body is controlling all these in normal physiological range. Yes, the medical physiology is the application of knowledge of physiology in management of the dysfunction and disease in the human being. See, physiology deals with the normal function. If we know the normal, then only we can differentiate from the abnormality. So first we have to learn what is normal in the human being, in the living organism. Then only we can differentiate from the abnormality. And by knowing the normal, we can find out the abnormal function, and then we can manage the patient. We can find out the disease, and then we can have the treatment mode. Okay, as we know, the physiology, next slide please. Next. Physiology is physiology occurs at various levels of the body, right from the molecular level to different systems. As you know, the physiology having the, for the easy of the study of the physiology, it is having the different systems which have the harmonious play. For example, endocrine system, reproductive immune system, urinary system, skin, nervous system, circulatory, respiratory, GI tract, all these are the different systems for the different kind of function. But see, all the functions are interrelated. Why we respire? We respire to take oxygen. This oxygen is carried by blood, which enters the blood through the circulatory system. This blood reaching the cellular level where this oxygen is utilized for the production of energy, and some waste is produced which is excreted through kidney. So all these systems are having their harmonious play, and because of that the harmony if maintained, then the normal function is maintained, so one can live a normal healthy life. So physiology deals with the more of the health of the person. Next time, next please. Now you can see there are two important ways of the medical science. One is anatomy and one is physiology. How we can differentiate anatomy and physiology? So anatomy is more of the structural aspect of the body or the different living organism other than human being. And physiology is the biology, normal function of the living organism. Anatomy more focusing on the size, shape, location, structures in the living organism, where the physiology is more focusing on the chemical, physical, electrical processes in the body of the organism. Anatomy is a static study, वो fixed है, where the physiology is a dynamic study. See, this dynamic function that is also very much see the principle of vital force. Here we can apply. Both are dynamic in nature. Physiology is having the dynamic aspect, and the homeopathy also believes in this dynamic vital principle. To understand the anatomy, which is obtained by dissection and the separation of the body parts of the living organism. See, in anatomy, we can dissect the dead body. But to understand the physiology, it is very critical. In physiology, particularly in the living organism, one can feel. So it is not a static study, it is not the fixed study, it is a dynamic study. And yes, next please. Now, next please. Why to study physiology? What is the importance of physiology? So being a living organism, we must know what the life is. So physiology expand our understanding what life is, how the life processes are going on or working, and how they are regulated. And if it's not regulated, then how the abnormality, which we call the deviation of the function, dysfunction, that is disease, and how to manage the disease. So we can have the plan of the treatment by knowing physiology and how the living organism cope up with the or adapt to the different environmental changes. See, here there is physiological variation, but if this exaggerated variation is there, then one can adapt. See, we evolve in the theory of evolution. We have studied the survival of the fittest. Only one can survive who gets adapted to the environment. So this adaptation is also the part of the physiology. Next, please. Here, how this it is also the study of the mechanism, how the animals are carrying out their normal function, how this modern days animal possesses the mechanism they inherited it from the ancestor, it was beneficial, then adaptation is there, and yes, the adaptation for the survival. Next, please. Please. Okay. Physiology for the learning of the medicine. See, physiology, we can say it is a base, a very basic, very fundamental, or one can say it is a mother of the medicine because it provides the essential knowledge of understanding the process of the homeostasis, which is defined as the consistency of the internal environment of the body. Homeostasis, as it is the maintenance of the internal environment within physiological limits. We have internal environment, we have a constant temperature maintenance, we have constant pressure maintenance, we have constant water balance. It is always maintained. And all this control, all this balance will lead to harmonize the internal environment. So there is internal environment which is always maintained during the physiological state of the well-being or the human being, that we call the homeostasis. So homeostasis maintenance is our main purpose. Then only one can maintain the health. If it is going beyond the range or the physiological limit, then the abnormalities start. It can be the hyperfunction or hypofunction. So we can understand only by knowing the normal range. Next, please. So how we can maintain the normal physiology? How we can maintain the normal internal environment? So physiology not only teaches us how the functions are going on, but our eating style, our eating habit, how to eat, how much to eat, when not to eat, when to sleep, when to do exercise, what kind of clothing we should wear, which is having certain influence upon the body, for how much of the water to be taken to maintain the normal balance of the water balance inside in different environmental temperature. In yoga is also one of the principle, and for the benefit of maintaining and benefit and for the maintaining of the physiology. So yoga is also the part of the physiology. It is to maintain the normal harmonious play of the internal environment. About sunlight, its effect, general benefit with the respect of the health. Yes, how much sunlight we should expose daily to maintain our normal. As we know, the sunlight is essential for the synthesis of vitamin D. But if you take the sunlight at the afternoon 1 or 2 o'clock, then it will have the adverse effect. So when to take it, when not to take it, one should understand. So physiology teaches all this with the about the climate changes, aging processes, different age condition, where there is a variation in the physiological limits during pregnancy, how much care is of the lady to be taken. Physiology also informs about the effect of the fragrance color. See, how we can enjoy the light, that also taught by physiology. Next, please. Next, please. Physiology provides us the knowledge to obtain and maintain the good health. Yes, with to integrate the knowledge with other field of the medicine. And yes, physiology also helps us for the spiritual growth, as in the aphorism number 9, for the higher purpose of our existence. Why we come to this world? So physiology is not only the mental, physical growth, maintenance, health maintenance, but it is also for our spiritual health, for the spiritual progress. Next, please. We talk about this is in general how the knowledge of physiology is significant for the day-to-day life, but for the medical practice, it is a base. So to becoming a good physician, see, in aphorism number 1 of the Organon of Medicine, the high and only mission of the physician is to restore the sick to health. So, first thing is, before treating the patient, one should be a good physician. So, if you possess a good knowledge of physiology, then one can be a good physician. And only good physician with all the sound senses and the knowledges can be a good physician. Physiology helps us to evaluate the disease condition, but before that, how we can prevent a disease and how we can give promotion to health. So different health promoting knowledge also can be obtained by knowing the physiology. Next, please. Next, please. So now we talk about a disease. Disease means dysfunction. Dysfunction means deviation from the normal physiological function. So it is the expression of the functional disharmony of the system that usually occur due to prolonged disturbance of any kind. If something is pinching us continuously, then our body coping up system will be failure, and that will deviate the normal function to abnormality. So that will the cause of the disease. So if we are exposing anything which is prolonged from long period of time, that disturbance will lead us to disease condition. So understanding the nature of the disturbance is critical to comprehend the pathophysiology related to the species. So we should only understand, say simply it is the thing, the deviation of the function. Deviation of the function can be only learned by what is the normal function. So one of the greatest, am I audible? Hello? Hello?
Yes,
Yes,
ma'am.
ma'am.
Yes,
You
ma'am.
Okay.
yes, ma'am. You are audible, ma'am.
The last one, the previous one, please. Only one or two line is left. Okay. So one of the greatest physiologists, Starling, you might have heard about the Starling, has already told that the physiology of today is the medicine for tomorrow. So anyone who is learning physiology, making his or her foundation very strong to learn medicine. Medicine is a diagnosis and treatment of the disease. But before that, how the disease is produced, how the outcome of the disease is that one should learn. So physiology of today is the medicine for tomorrow. And yes, one can learn the different actions of the drug on the level of physiology. So physiology is the physiological basis of the drug also must be known. Knowledge of physiology helps us to find out the remedial reactions where the drugs are going to act on which system, on what part, or at the level of the which cell. Next. Next, please. So now we will come to the main point, that is the integration of the knowledge of physiology with the homeopathy. See, this integration will help us to find out different points. So it is very essential for the understanding of the health. Yes, what the health is. First, one should know what the health is. And health is nothing but the maintenance of the normal function. That is physiology. Second is, it helps us to understand the disease. If one understands the health, one can understand the disease. And then after, patient will come to you with a certain symptomatology. So we have to find out which system is affected, what kind of symptomatology patient is coming with. For that, we should consider everything, including the constitution, everything. If the chronic diseases are there, then one can plan the individualistic approach of the treatment. And then yes, after individualization, if we plan the treatment, we can understand by the physiology different action of the homeopathic medicine, how the homeopathic medicine works on the physiological basis. And this knowledge of the physiology also helps in the research like clinical outcome, case studies, and yes, different homeopathic pathogenetic trials. So the first point is to understand the knowledge of integrating the knowledge of physiology with the homeopathy. As we know, the homeopathy is a holistic way of medicine which helps. Next slide, please. Please, next. As we know, the homeopathy is a holistic way of medicine which treat the patient by considering or by taking into account the physical makeup, physical or the bodily, emotional aspect and the mental state of the person or the diseased person. So, human physiology, on another hand, focuses on the coordination of the different function of various systems within body, explaining how they maintain the homeostasis and respond to the external and internal changes. See, homeopathy defined the health as a harmonious play of body, mind, and soul. Same way, it is something which is internally dynamically going on. The same way, physiology also focusing on the coordination of different systems, different functional aspects of different systems in the body. So both are going parallel in this way. Integrating the homeopathic education with the study of the human physiology allow the practitioner to deepen the understanding of the disease. Yes. So here, if we apply the knowledge of the physiology, a physician or the practitioner can understand which system is affected or to what level the this changes are there and what is the outcome of the disease, what is the symptomatology of the disease. One can understand if and that helps, and by knowing the nature of the patient, one can help in the it helps in the individualization also. As we know, the different age, different sex, different person having a different physical makeup, mental makeup. So by considering all this in normal condition, we can individualize the patient. As a principle of the homeopathy, this harmonious play of the mind, body, and soul. Same way, physiology teaches us the harmonious play of the life going on by synchronizing the different life process. Next, please. In the aphorism number 9, the principle of the vital force is stated by Dr. Haniman. In the healthy condition of the man, the spiritual vital force, autocracy, the dynamism that animates the material body, which we call the organism, rose with the unbounded space and retain all the parts of the organism in admirable, harmonious, vital cooperation as regard both the sensation and function, so that our indwelling, reason gifted mind can freely employ this living healthy instrument in for the higher purpose of the existence. See here, healthy condition is not restricted to our mental or physical growth or the normal function, but is also helping us to reach our goal, our mission, our higher purpose of existence. Why we come to this world? See, we are human beings. We are the highest kind of animal. So why the Creator creates us? But with what purpose we came here? So every human being is having the purpose to live, and our purpose is to make other life easy. So to make this higher purpose of the existence, the spiritual growth also can be achieved by physiology. Next, please. In the 10th aphorism, it is stated that the material organism without vital force is capable of no sensation, no function, no self-preservation. It derives all the sensation and perform all the functions of life solely by means of the immaterial being, which animates the material organism in health and diseases. If health is lost and disease is there, that means something wrong is going on inside. Inside means the material body, the organism is required for the vital function to show its normal abnormality, both. If it is lost, then it will lead to death also. So if it is dead and only subject to the power of external physical world, it decay, it's again dissolved in the chemical. So this is the end of the life. If the vital force stop working, stop functioning, the harmonious play is lost and the person becomes dead, losing all the power of life, powerless, only body is there, which is again returned to the soil by decaying process in different way and become again the chemical constituent. Next, please. Next, please. This we have discussed the vital force. Next, please. Yes. So by integrating the homeopathy with the human physiology, one can easily understand the disease process. The Guyton and Hall, the great physiologist, also emphasize the role of the physiological knowledge in decoding the interaction between the different bodily systems such as immune system, endocrine system. See, the great homeopath Vitholkas also states that by integrating this field, homeopathic remedies can be more effectively applied when there is an understanding of the how body functions on the cellular and the systemic level. Next, please. Next, please. Am I audible? Yes. So here you can see the integration of the homeopathy, which is integration of the knowledge of homeopathy and the physiology by physiologists Guyton and Hall. Vitholkas also stated that it is very much essential for the understanding the body function at the cellular and systemic level for the effective reaction of the medicinal power. Next, please. So, this is the fundamental thing one should know. The knowledge of normal function, then we can understand the abnormality, which is manifested in form of different signs and symptoms. And that manifestation that is indicating the abnormality, abnormal function, which helps to develop a clinical and diagnostic skill. So here we can see a vertical knowledge of physiology, that is a normal function, the deviation which leads to pathophysiological condition, the changes in the right from the cellular to systemic level, which is with the manifestation, that is a symptomatology, medicine, the vertical knowledge, physiology, pathology, and then medicine, practice of medicine, where we can learn the abnormality with the symptomatology, mode of treatment, how to diagnose the disease. And yes, by learning all this, one can be perfect in the diagnostic skill. Next, please. So, next, please. See, by knowing the health and the disease, now the next point is how to diagnose the disease. Yes, we know that the function is deviated, the function is disturbed. The person is now diseased. So, what kind of disease he is suffering from? For that, one should have the diagnosis, naming the disease. See, we in homeopathy, we don't believe in the naming of the disease, but yes, for the integration of the different field of the medicine with the homeopathy, one should know the disease condition. So the integration of the physiology in the homeopathic education improves your diagnostic accuracy. How by learning the how organ system function, practitioner can make the more precise correlation between patient symptoms and the physiological state. For example, a homeopathic treatment for the cardiac problem can be effectively handled. The practitioner understand how the heart and blood vessels operate under normal and pathological conditions. So how the heart is working normally. If it is having certain changes, that it's indicating some deviation is there. So one should know. For example, the normal heart sound. If the heart sounds are normal, that means the heart is working normal. If the heart rate is normal, then yes, one can know that normal. But if any limit is crossed, if any deviation from this normal range, one can understand, yes, something is wrong. So here we can have some diagnosis. Physiological knowledge allows the healthcare provider to interpret the clinical signs within the context of the organ system, cellular function, and biochemical pathway, making the diagnosis more accurate and personalized, helping also in the prognosis of the disease. That means the progress of the disease. Yes. So here one can plan the treatment by diagnosis. One can understand the disease process and yes, the prognosis of the disease. So how the disease is progressing, in what direction it is progressing. So knowledge about the physiology, which helps us in the pathophysiological action of the homeopathic medicine, helps us to be building the base for the diagnostic and clinical examinations. Yes, the individualization, which is the very important principle of the homeopathic treatment, homeopathic approach. So here, understanding the patient unique physiological makeup, such as variation in their immune response or the hormonal level, homeopathic practitioner can also select the remedies effective. Next, please. Next slide, please. Next one, individualistic approach of the treatment. Yes. Individualistic approach of the treatment. So here, by considering the physical makeup, in normal condition, one can have the idea about the not only disease but also about the patient's constitution, normal habits, physical makeup, and by this one can plan the treatment on the basis of individualization. Next, please. Please. Yes. So individual medicine, by individualization, we can find out the medicine by knowing the structure, function, alter structure and function, and manifestation or the action, the treatment. Yes, the homeopathic point of view, the physiological knowledge will help us in the different research process like clinical outcome. If we go for a trial of the research trial, what will be the clinical outcome? What will be the case studies? How the homeopathic proving can be carried out, and one can know the homeopathic pathogenetic trial. So this is the aspect where also in advanced homeopathy the knowledge of physiology helps us. Next, please. Next, please. Yes. So we will now go for a 2 to 3 medicine, how they work, how the physiologically the action is carried out. So here we understand the action of the different homeopathic medicine. Next. Next, please. As you can see, the living organism, the most fundamental aspect is atom, then molecules, genes, organelles, cell, tissue, organ, system, organism, then the group of the human, hello, group of the animals, and together with harmonious living, the ecosystem of
Yes, ma'am.
different. Yes, the
Uh,
slide is not visible. Hello.
yes, ma'am. Moise sir, kindly check the technical issue, sir. Yes, ma'am. It is sorted, ma'am.
Yes. Okay. So action of the homeopathic medicine does occur at the subcellular level. Subcellular. So here molecular physiology is very important. Molecular physiology means the uh, physiology of the atoms, proton, electrons also, because our medicine having that depth of action. So in-depth understanding and correlation of the processes in the health and the disease can open up the whole new way of understanding homeopathic drugs and their far-reaching effects. Next, please. Physiology helps you to understand. So up till now, what we have seen, that physiology helps us to understand, number one, the disease process. That is a manifestation of the disease. The second step is group symptoms. As we know which system is affected, by knowing that the group symptoms of the particular disease can be understood. For example, GERD. So it involves the digestive system. The next one is pathognomic symptoms of the disease. Means there are a peculiar type of some symptoms are there in certain type of diseases. For example, Koplik spot in the measles, which is very characteristic. So here, pathognomic symptoms, which helps us for the individualization, for making the treatment plan or to choose the medicine. And fourth one is developing ability to differentiate pathognomic and non-pathognomic. So all above is related with the pathophysiology. And once we understand the pathological, physiological aspect of the medicine, now we can identify the patient's individual symptoms, individualization. On that basis, totality of this symptom can be made, and we can select the medicine. Next, please. Next, please. So the first thing to learn about the drug is its physiological and pathological action upon the healthy human being, to know what tissue it acts upon and just how it operates. Then lead directly to its curative action. And for drug like men have the characteristic by which they can be known and distinguished one from other. So here we can understand the physiological and pathological action of the drug, and by this at what level it is affecting the body, and by that we can find out that curative power. As we know the principle of the homeopathy. Next, one drug can act upon the nerves. Suppose one drug is acting on the nerves of the motion or the motor system, the other will act on the sensory system, which is related with the sensation. One drug act on the parasympathetic, which is related with the relaxation, where the other sympathetic, which contract constricts. So one act upon the mucous membrane, where the other will act on the bone. So here we can differentiate different drug having the different system to act on and to produce certain pathological conditions which is localized. From this localized affection by reflex action, the whole system is implicated. Next, please. The slide is not visible. Please.
Yes, ma'am. Moise sir, kindly check the technical glitch, sir.
Okay, for example, yes, next, please. Next slide, please. Yes, you can see here one example I'm giving. Capsicum and the Atropa belladonna both belongs to the family